It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Pillay-Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Happy Aloha Friday. Thanks so much for joining us here on Spotlight Hawaii. I'm Yanji Denise. Ryan has the day off, but we are continuing our conversation here with a guest that always gets a lot of questions and someone we love to speak with. That is Dr. Tim Brown, infectious disease expert of the East-West Center. Dr. Brown, thanks for being here this morning.
Happy New Year, everyone.
Happy New Year. Well, we had a lot of holidays. That means we had a lot of gatherings and quite a bit of travel. I was telling you before we got started just that it is really hard for me to make heads or tails of how we're actually doing when it comes to COVID, because you hear about global events like what's happening in China. You hear about what's happening on the East Coast with new variants. And yet it does seem day to day that things have really changed. So bottom line, where are we when it comes to COVID?
Okay, yeah, I'm going to agree with you. I think it's a difficult situation for people to understand at this point. Part of the problem is that it is a complex story. The data sources we have available are changing over time, and that I think is making it more difficult for people to actually interpret what's going on. So what I really want to do is kind of maybe try to go through our local data in a little more detail for the next few minutes and try to help us understand what happened over the holidays here. And, to do that, I'm going to focus on Oahu because the data is strongest there. And so, the graphics I'll put up basically will be related to Oahu. But let's start with the number of cases. Can you bring up the first slide?
Yes, and Dr. Brown has these slides that he is sharing with us this morning, and that's really to kind of put all this into context. So let's go through them. Please go ahead.
Okay, this first slide shows you the green dots here basically are the number of cases over time on Oahu. And you can see that basically we saw that upward blip that occurred around Thanksgiving time. But then that came back down, and after Thanksgiving, we were down again to about the same level we were at before Thanksgiving, which is about 110 to 100 cases per day. 110 to 120 rather. And then we see toward the tail end of this, we're starting to see the numbers go up again, and that's going into Christmas time. Okay, it's important to remember these average case numbers are about a week old. So this is really kind of, going back into Christmas week. So that's what the case numbers imply, which would imply that we're pretty much, back to a similar level to what we were at before the holidays. So the holidays may not have done too much harm. But we have to look at other sources of data as well, because cases are affected by the amount of testing, and we'll talk about that in a little more detail. Let's put up the next slide. This slide shows you the average test positivity on Oahu. And the positivity is less affected by changes in the number of tests than the case number is. So in that sense, it gives us somewhat of a better trend of what's going on. You can see if we go back to early November, we were relatively flat at about 6%, and we had been at that level for almost 3 months at that point. Then the week before Thanksgiving, we see the numbers start to go up. That's basically people are getting into their pre-Thanksgiving gathering, shopping, et cetera, et cetera. And then we kind of reached a peak around Thanksgiving time at about 7.5%. Then over the next 3 weeks, it started to drop a little bit. And it had gotten back down to the week before Christmas. It was down to about 6.5, but then Christmas parties, last minute shopping, all of that kicks in. And we know how crowded the stores were, how many Christmas parties were going on, since for many people, this was the first Christmas party in like 3 years. And so we saw a very substantial rise in positivity from 6.5% up to about 9.1% by New Year's. So fundamentally, the positivity is telling us a different story than what we're seeing in the cases. The cases are saying things blipped up at Thanksgiving and then came back down and stayed level. The positivity is telling us they went up again at Christmas. Okay. Now we have other.
I'm sorry.
Part of the question.
Oh no, I think I skipped to the next one, so we'll stay here.
No, go to the next slide. That's fine.
Okay.
Okay, so what's the reason for this difference between what the cases are telling us that are saying we're fairly stable, but the positivity telling us that we've gone up about 50%? Well, the difference is the number of daily tests that have been done. And this shows how testing has been changing on Oahu. You can see the week before Thanksgiving, testing just dropped. We went from about 1,400 tests a day, where we've been stable for several months. Then we dropped down to only about 1,000 cases per day being tested shortly after Thanksgiving. Then it came back up again after Thanksgiving, but then it continued a slow decline and then dropped again just before Christmas and has been staying fairly low. Now, because we basically get the case numbers largely from the number of positive tests, when the number of tests goes down, the number of cases goes down. And so what we need to do is we need to consider other sources of information to get a clearer picture of what's going on here. Because right now the cases are saying we're pretty stable, positivity is saying we're up. Okay, so what other sources do we have? Next slide. One of the other major sources we have now is data on concentrations of COVID in wastewater. Okay, and this graph shows you the red arrows here basically are Thanksgiving. And you can see that the concentrations after Thanksgiving started to rise in all three counties, Hawaii County, Honolulu County, and Kauai. Okay. On Hawaii and Honolulu, they continued to rise through Thanksgiving, or through Christmas rather, and Hawaii is just showing a little bit of a drop in the last couple of weeks or couple of days, but I wouldn't overinterpret that right now. Whereas in Honolulu, we've continued to rise. Hawaii went up after Thanksgiving, went down, and then started to go up again as Christmas approached. Okay, so the wastewater is telling us that there's more transmission going on. Okay, so what other information do we have? We have hospitalizations. Okay, what hospitalizations tell us is we were at about 60 people in the hospital per day with COVID before the holidays. After the holidays, the last figures that just came out a couple days ago put us at about 80 cases in the hospital. So again, there's been an increase in hospitalizations in terms of the average number of people in the hospital with COVID. Okay, so all of that basically implies that what we're seeing is about a 20% increase in transmission that was associated with the holidays. Okay. Now,
okay, what is this?
This is good. What we might expect going forward is that the numbers would start to come down again, just like the positivity started to drop after Thanksgiving. And if things stayed the way they were, if our mix of variants stays as it is now, then we would expect that, and we'd probably be dropping back down to about that same 110 to 120 cases per day that we were seeing before the holidays. However, there's a fly in the ointment. And that fly in the ointment is XBB 1.5. So what is that? XBB 1.5 is a new variant that basically got on everybody's radar about a month ago. Doesn't sound unlike Omicron last year, which basically came onto everybody's radar in early December. Well, people started looking at XB 1.5 in early December. It's a child, excuse me, original variant XBB that was first detected in Singapore and in fact produced a pretty big spike in Singapore back in October. It's a recombinant. Okay, it's the first recombinant that's kind of going global, if you will, that's becoming a major player. A recombinant is when a person gets infected with two different variants, and the variants kind of swap pieces of themselves. Okay, so the child that comes out of that recombination event has pieces from one variant and different pieces from another variant. And that basically makes it a new variant, and it acquires some of the properties of both of its parents. Okay, so this one came out of two BA2 children, BA 2.75 and BJ1, and it, like I say, it first was spotted in Singapore in October, where it produced a spike of about 280,000 infections. Now, fortunately, in Singapore, the fatality at that point was very low. Only about 100 deaths resulted from those 280,000 infections. That's only about 0.04%. And because they didn't detect all the infections, almost certainly, the percentage of deaths is probably even lower. But it's important to remember Singapore is a very highly boosted and highly vaccinated population. Over 75% of the population has received a booster in the last year. Now, XBB 1.5 is actually a US variant. It's a new guy. It basically grew up. No, let's go back to the other one. Okay. It started here in the United States, first detected in New York. And you can see here, it's the dark blue, the second entry in the legend here. And you can see it's growing fairly rapidly within the United States. It started about 1% a month ago, and now it's up to about 28%. And it's the fastest growing variant in the United States right now. We're still seeing a lot of BQ1 and BQ1.1, which are the dominant variants here in Hawaii right now. But XB 1.5 is growing pretty quickly across the country. Now,
and so this chart is the US mix overall.
Yeah,
this is not Hawaii. This is the entire nation.
Right. This is not Hawaii. This is the entire nation.
Okay. Let's
And the next slide. This slide gives you some idea of what the mix looks like across the country. The dark blue here again is XBB 1.5. And you can see in the northeast of the country, we're basically seeing almost 3/4 of new infections are related to XBB 1.5. So this really is growing very fast in the Northeast, and we expect that this is going to spread across the country. You can see when we go down to the middle of the eastern coast, we're seeing about 1/3 of the cases now being XBB 1.5. So we do expect this to spread. It has a real growth advantage over the other variants. And so we expect that we're going to see this pretty much across the country over the next month and a half. Now, it has been detected in Hawaii, actually in the wastewater sampling. The variant report that not the variant report, but the wastewater report that the Department of Health released just a couple of days ago basically has detected this variant in our wastewater. So it is here in Honolulu. That was the one site where they detected it. Okay, so we do have to worry about this. Now, so as it takes off, the question then is what's going on with hospitalization? So next slide. This is COVID hospital admissions across the United States. So I'm looking at the entire country first. And this is broken down by age. The dashed line near the bottom is the overall population. Okay. The top line is those 70 plus, the next line 60 to 69, so on. So fundamentally, you can see that among the entire population, the dashed line, we're at about the same level of hospitalizations that we saw during the BA5 wave. Now, this is across the entire United States with that entire mix of variants. So most of this is actually BQ1 and BQ1.1. But the effect is particularly pronounced among older people. So you can see here the 70 plus population is being hospitalized at an even higher rate than they were during the BA5 wave. Now let's look at places that have predominantly XBB 1.5. Next slide. Okay, this is Massachusetts, where XBB 1.5 is now the dominant strain. It's over 3/4 of all the cases being sequenced there. We can see here that the 70 plus are still rising and rising very, very rapidly in terms of hospitalizations. And they're actually getting up close to where the BA1 wave, that big wave that hit us last Christmas, came. So we're seeing a lot more hospitalizations in those places where XBB 1.5 is becoming dominant. And that's one of the reasons why people are pretty concerned about this at this point. It's that fundamentally we may end up with a growing spike of hospitalizations as XBB 1.5 spreads across the country. Next slide. Okay, now this is what we call the reproductive number. I'm going to use this just to try to explain our situation here. Okay, the reproductive number is actually a pretty simple concept. It's the number of infections that will be produced by one current infection. So if a person is currently infected, over the entire course of their illness, how many other people are they going to infect? So if that number is below 1, then each person infects less than one person. And if that continues over time, the epidemic will die out. If the reproductive rate is at 1, that is, each person infects one other person, then basically we'll end up with a flat trend, very similar to what we saw here in Hawaii back in the earlier part of this year, right, from September through basically through Thanksgiving. We pretty much had that nice flat. Well, that's when the reproductive rate is about 1. So each person currently infected is infecting one other person. If the reproductive rate is above 1, then each person is infecting more than one other person, and we'll end up with a growing epidemic. Okay, so let's look at the Hawaii epidemic in terms of that. Our initial wave back in July was BA5. If you look at BA5 on the left side of this graph, it has a reproductive number of about 0.8. So what we saw was over time after July, that BA5 epidemic died out, and we saw those decreasing case numbers that we had until early September. By early September and October, we were starting to see the BQ1 variants coming in, and they were becoming more dominant here. Those have a reproductive rate of about 1. So basically what they produce then is a fairly flat epidemic, very similar to what we saw in that first graph. We were very flat for almost 3 months until Thanksgiving blipped it up, and then we came back down again. So that was the effect of BQ1. And all these other new variants, if you look at this entire mix of variants here, the vast majority of these newer variants are around a reproductive number of 1, which means they just maintain a steady state epidemic. And so that's basically what we saw here in Hawaii. Now, what we're worried about now is XBB 1.5. If you look at this graph, on the right-hand side, there's one real outlier here. That big red point up in the, upper right corner of this graph, XBB 1.5. It has a reproductive number in the United States right now of about 1.6, which means it is producing growing epidemics. And that is what we're seeing very strongly in the Northeast now, but it's only a matter of time until that spreads to the rest of the country, and we'll be seeing growing epidemics. So probably what we're expecting in the next couple of months is we will see an increasing epidemic across the U.S. and probably also here in Hawaii.
Oh, always sobering to talk to you, but always very informative. On that last slide, we do have a question, and there are some other questions in the comments that I'll get to in a moment, but let's start with this one from Anne Marie. What was the R number, reproductive number for Omicron, et cetera? I know you said that last slide sort of showed a mix of the variants. Interested to know, because Omicron sort of sticks in our mind, where that falls in relation to XBB 1.5.
Okay, this reproductive number I'm using here is what we call the effective reproductive number. It's the reproductive number that takes into account how transmissible the virus is, but it also accounts for population immunity. That is, people in the population who basically are immune or less likely to get infected, maybe from a recent infection or because they're vaccinated or boosted. Okay, so that takes that into account. By itself, the reproductive number is probably up around 12, 13, what we call R0. But the effective reproductive number, which takes into account population immunity, current risk within the community, et cetera, that's only about 1 right now for most of these other variants. But for XBB 1.5 with current risk behaviors, it's up around 1.6. So we're seeing, an increasing epidemic with XB 1.5.
I want to bring in this question from Heidi because, a lot of that data that you've just presented to us is national data, but she's asking about something that we're all sort of looking at right now. Can you ask Dr. Brown if he's concerned about the rising numbers in China and potential for mutations as vaccination rates there and booster rates here, frankly, are low? Interested to know what you think the effect of the change in COVID policy and protocols in China, especially now that they have lifted a lot of their travel restrictions.
Yeah, I mean, honest truth, China is a bit of a disaster right now. Fundamentally, they opened up, as the question implies, and as most people know at this point. They were in severe COVID restrictions over the last 3 years. Anytime they caught a COVID case, they would lock down, in many cases, entire cities. until they basically tested everybody within that area and basically stamped it out. But what ultimately happened was about the middle of this year, they started to lose control of it. The virus was evolving in such a way that it was becoming so much more transmissible that those lockdown approaches weren't working anymore. Simply, you'd lock it down and then people would continue to get infected because it was so transmissible. And that wasn't true in the early cases. With Delta, which was far less transmissible, they actually stamped out many introductions by basically testing everybody in the city. Okay? Because Delta wasn't that transmissible. But Omicron variants became so much more transmissible that the lockdown approaches just wouldn't work anymore. And that was the real issue. So what they did then is they were finding themselves having political problems because people were being locked down so much, and they were not providing food in many cases. And then there was a fire. Right? One of the lockdown sites basically was a fire that killed a lot of people. And basically that was kind of the turning point, because at that point, the Chinese government realized if they kept up these restrictions, people would revolt against them. And, if there's one thing the Chinese government is responsive to, it's when they feel the population may be turning against them. And so what they did then was actually probably about the stupidest thing they could possibly do, which is they lifted all restrictions almost immediately. Didn't prepare. They didn't do what places like New Zealand and Australia did before they opened up, where they actually went out and tried to vaccinate everybody with a real emphasis on getting vaccinations to the older members of the population. China didn't do that. Now, they have a high vaccination rate. The vaccination rate's over 90%, but it was done more than a year ago. And with the Chinese vaccines, which are actually pretty inferior vaccines, they don't work anywhere near as well as the vaccines that we predominantly use here in the West. Okay. So what we ended up with then was a population which had very little exposure to COVID before, so there was no protection from previous infections. They were vaccinated a long time ago, and their boosting rate was only about 40% in the last year. So, 60% of the population didn't have that much vaccination protection left anymore. And on top of that, they had not vaccinated the older people. For some obscure reason, they decided that giving older people a third dose of this vaccine would be risky to their health. And so they actually under-vaccinated older people. And that's a real problem, because that's exactly the same thing that happened in Hong Kong. In Hong Kong, they under-vaccinated older people largely because of fears of the Chinese vaccine. And then when BA2 went in there in March, it killed over 9,000 people in just under a couple of weeks. There was a massive death toll in Hong Kong, 9,000 people out of 6 million population. And most of those were the elderly. So China's doing the same thing. They're opening up, not doing anything really in terms of precautions. They've removed all the travel testing requirements they had. They don't really have much access to palliative care. Their hospital system is much more limited than ours is. And so basically they opened up, and then on top of it, they told people, well, don't worry, Omicron's only a mild infection.
And we have the Lunar New Year approaching.
And we have the Lunar New Year. And
quite a bit of
problem
travel.
is Omicron's not a mild infection in a population without much immunity. And that's the Chinese population. So the real fear right now, the current estimates are that at least 250 million people have become infected already. And that's just in the month that they lifted the restrictions. Okay. The expectations by the end of the year are that we may see anywhere from 700 million to even close to 1 billion people infected with COVID in China. Okay, so
at the same time?
Over the next year.
So over the course of the next...
Over the course year, you'll end up with, 700 million people.
Wow. So if you look at that, going back to Heidi's question, what does that mean for variants? Because we're focused a lot of our conversation, of course, on the homegrown variant, which is obviously a very big concern right now. But what could be happening there if you have that kind of spread?
Well, strangely enough, it probably doesn't mean that much for variants, because it's largely a population with low immunity, which means the virus doesn't really have to evolve very much to infect people.
Interesting. Okay.
So actually, when you talk to the reproductive biologists and the people who basically look at these things, most of them are not too concerned about variants coming out of China. they're much more worried about the variants that are coming out of the United States, like XBB 1.5. And a lot of the other variants that we had before, the Delta variant basically came out of India. The Alpha variant that gave a big wave 2 years ago came out of the UK. So we probably don't have as much to worry about variants coming out of China as we do anything else. And so the bottom line is that, these testing requirements we're putting on people coming on flights from China and so on, number one, they're going to miss a lot of people because, again, they're doing the 2 days before sort of thing. And these infections occur so rapidly and at such a high rate that a lot of people can get infected in that window period. It'd be better if we actually tested people before they got on the plane. But the problem is, even the Chinese come here infected will be a drop in the bucket compared to the number of local infections that we're generating already. Here in Hawaii, we know we generate, on Oahu alone, we're generating at least 100 new infections every day. So, a couple of plane loads of people coming from China with, a 20 or 30% rate is probably not going to do that much to our local spread. The local spread is determined by the behaviors of the people in the location. And the U.S. right now is not taking much in the way of precautions.
Well, let's talk about that. Surprisingly, this conversation goes so fast. We only have a few minutes left. So let's talk about what we should be doing right here at home. I mean, to be honest with you, I've been boosted several times now. My children are vaccinated. They've been boosted when appropriate. But I've kind of personally lost track of, when's my next booster and when is my kid's next booster and when am I supposed to be doing this? And I'm someone who takes this stuff pretty seriously, I would think, and tries to stay on top of it. So where are we when it comes to boosters? And is this something that, we can expect news to be released and then we all go out and get one? Is this something we're supposed to be tracking ourselves? I mean, I certainly can't be alone in sort of losing track of this.
You're not. And honestly, I think CDC has once again dropped the ball in terms of explaining to people what's going on with boosters. Okay, they talk about fully vaccinated. They still talk about that as just being the original 2 shots. That is not fully vaccinated. That's if you got the 2 shots 2 years ago, you have very little protection against COVID from those 2 shots right now. You got some protection against serious illness and death, but no protection against infection. It's waned, it's gone. And so if you haven't been boosted recently, then it really is a problem in terms of your susceptibility both to infection and also to serious illness. And so, here in Hawaii, our current booster rate is about 44% of people have had a boost of some sort in the last year. So that means, another 56% have not had a booster in the last year. So they don't have a whole lot of protection against getting infected with Omicron unless they had a recent infection. The recent infection will again protect you probably for, 6 months to maybe a year, but it's waning by the end of that year, just like it does with the other coronaviruses. So generally, the recommendation will be that most people will probably need to get boosted about once a year. Now, the problem we've got right now, like I say, 44% here have been boosted in the last year, but the new bivalent vaccine, the one that includes a piece of Omicron, that's only been taken up by 23% of the people here in Hawaii. And it's only been taken up by 15% of the people nationwide in the United States. So that means that a lot of people are losing their vaccine protections right now. And so, I would really strongly recommend, especially with this XBB 1.5 coming, that people go out and get boosted right now. The boosters, they're still free. You can basically sign up for them and just, go and get it. It's not going to cost you anything. And it definitely will give you more protection, especially against serious illness and death. It'll probably only give you about 40-50% protection against infection for maybe 2 months. After that, you'll be subject to getting infected again, but your protection against serious illness and death will last much longer. Okay, and that's why they're saying go for about a 1-year booster schedule for most people.
Okay, well, I did get that bivalent booster, but I'm going to go check my vaccine card and double check the dates because it does seem, it's just one more thing to keep track of. And we kind of have forgotten. We've dropped a lot of the masking as a community and really just sort of have continued on with life as usual. But based on what you're seeing in the, few minutes we have left, what are your expectations for the next few months when it comes to COVID? And other than getting boosted, what's your message today?
I do think we're going to see an XBB 1.5 wave. Okay, I think that's going to occur probably across the United States. Now, exactly how high it will be, we don't know yet. Okay, It may be as high as the BA.5 wave we had earlier this year. It may not be. It may be lower. Part of the problem is you're trading off people's immunity, which is changing and is different in different parts of the country, against the high transmissibility and immune evasion of this particular variant. So we can't really predict how high it will be. I would expect to see cases starting to rise in the next few weeks, although I don't know the extent to which that will occur. In that circumstance, I would certainly recommend that older people and anybody who's immunocompromised or at high risk for severe COVID illness, those people basically should take more precautions right now. Okay, they should definitely get boosted if they have not been boosted. They should think about wearing masks in crowded settings. Think in terms of harm reduction. Okay, you don't have to wear a mask everywhere, but certainly when you're going into a very crowded setting where there's a lot of people, especially where there's a lot of people hacking away, which is certainly describes many of the stores I've been in recently, you really want to be wearing a mask under those circumstances. Okay, because it's not just COVID out there; it's flu, it's RSV, it's rhinoviruses. There's actually 15 or so different respiratory viruses that are spreading in the United States right now. So, masking is not a stupid idea at this time of year when a lot of people are getting sick. So, I would definitely recommend people consider masking. If you are immunocompromised, you have to be extra careful because many of the treatments we have now lost their effectiveness against many of these new variants. So Evusheld doesn't work against all the new variants. It works against some of the older ones like BA.5, but doesn't work against some of the new ones. Okay, so we're losing the effectiveness of some of our treatments. Fortunately, Paxlovid and remdesivir still work, but there we have problems with people getting access to them. People don't know about them. Doctors don't prescribe them. And so I think a lot of the deaths that we've seen in Hawaii in the last year could have been averted if people had gotten Paxlovid. But they didn't know about it, or they didn't get it soon enough, or their doctor didn't prescribe it for them. So I think, be ready to get that. If you test positive, if you get the symptoms of respiratory illness, do test for COVID. And if you test positive and you're in a higher risk category, go get a Paxlovid prescription from your doctor. It's really important.
Okay. Dr. Tim Brown, the half hour goes so fast. We're over time now. We always appreciate all the information that you share with us. Thank you so much and Happy New Year.
My pleasure. Happy New Year, Yunji.
Great to hear from Tim Brown. He always brings some sobering statistics and great information for us. If you missed any part of this conversation when we log off, go back and watch from the beginning. He presented about 10 slides with us this morning, really walking us through the mix of variants we're seeing across the United States and the hospitalizations that XBB 1.5 is bringing to some of the regions where you're seeing it most prevalent, that of course being the Northeast at the moment. And really the people who are the most at risk for those hospitalizations, of course, tend to be those who are elderly and immunocompromised. He again making the case to get a booster if you have not already. The statistics he shared there, just about the low uptake of the new bivalent vaccine here in Hawaii. Very important for all of us to go back, check those vaccine cards, check with your doctor, see if it's perhaps time to get that booster, especially because we see what is happening in the Northeast and on the East Coast, and we see those numbers ticking upward as they head west. And that, of course, means that they are heading to our shores. Very interesting to hear also what he said about China. So many of us have been concerned and worried about what possible variants could come out of China. Dr. Brown says that infectious disease experts are not as concerned about the variants in China. They are worried, though, about the rate of infection. We could see over the next year upwards of 1 billion people infected with COVID in China. It's spreading like wildfire over there, and they really don't have the healthcare infrastructure there to support all of those people. So we could see some pretty severe outcomes when it comes to China. And then just talking about behavior, on a day-to-day, that masking when appropriate, when you feel that perhaps you're in a crowd of people and perhaps there are a lot of folks you don't know there. Even if you do know people, of course, we don't know their vaccine status. You don't know if they could be asymptomatic and carrying COVID. So always a good idea that especially if you are immunocompromised, to mask up when appropriate. And then talking to your doctor about Paxlovid if you happen to be infected and you are concerned about, what could happen with COVID, making sure that you have access to that medication. It is still very effective, he says, in helping to prevent those more difficult outcomes. So we love catching up with Tim Brown. If you missed any of the part of this conversation, remember, you can always go back and watch from the beginning, catch it later as a podcast. So if you do listen to it as a podcast, you're going to miss the visuals, and the slides were very informative. On Monday, we are switching gears. We'll be talking about homelessness in our state. Connie Mitchell from the Institute for Human Services, IHS, will be joining us, kind of giving us a snapshot of what she is seeing when it comes to the homeless population in our state. I had an opportunity to speak with her just in preparation for our interview. You are going to want to be here on Monday because she has also some very sobering information about what is happening and who is vulnerable in our community. Those federal funds are drying up, and what she is predicting for the future, and what she's going to the legislature with this session to see to get some assistance and to try to keep people from becoming homeless in the first place. So join us right back here on Monday for another conversation on Spotlight Hawaii. I'm Yunji Denise. Have a great weekend, and aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.